The number one question I get on my social media is this: how can I get bigger, longer, or add more girth? Well, today I'm going to break this down for you: the evidence, the options, and the truth behind penile lengthening treatments. I'm Dr. Sarah, a urologist and pelvic surgeon. A urologist is a doctor who takes care of the urinary tract and the genitals, both medically and surgically. If you like what you see here, don't forget to subscribe so you never miss a new video. Now, let's start with a reality check. A massive survey of 50,000 men found that over half, 55%, were unhappy with how their penis looked. But when researchers asked their female partners, 85% said they were satisfied. Here's the point: your confidence matters more than anyone else's opinion. But we can't ignore the influence of pornography, which has distorted what people think of as normal. So, what is actually normal? The average penis length worldwide is about 5.2 inches, 13.2 centimeters. A range above or below this is perfectly normal. The only time length is considered abnormally short is when it's less than 2.9 inches, 7.5 centimeters, a condition called micropenis. And that's incredibly rare, found in only about 0.14% of the population. Most men who feel too small actually fall well within the normal range. The real issue is something we call small penis anxiety, where the penis is normal, but the man feels distressed, obsessed, or dissatisfied with its size. This isn't a joke, it's serious. Studies show some men spend hours every day thinking about it, some avoid intimacy, and in extreme cases, it can even lead to depression or suicidal thoughts. That's why we need to talk about it as part of men's health. Now, here's another problem. If you Google how to make my penis longer, you'll get bombarded with ads, pills, injections, and overseas clinics promising miracles. Many of these are unsafe, unproven, and can cause permanent damage. Please, do not go down that road. The Sexual Medicine Society of North America is very clear. Penile lengthening and girth procedures are not recommended for men with normal anatomy. They're considered experimental, except in true cases of micropenis. That being said, there are some treatments discussed in the medical literature. These fall into two categories: non-surgical and surgical. Let's start with non-surgical. The first and most important is psychological counseling. Working with a trained therapist can help men understand what's normal and reduce the anxiety that drives dissatisfaction. In fact, many men who receive only counseling and nothing else often lose the desire for any surgical or device-based treatment. Then we have mechanical options: penile extenders, vacuum erection devices, injections. Of these, only penile extenders have shown consistent results. These devices use gentle traction, pulling the penis slightly over long periods to gradually add length. What do the studies show? After months of daily use, most men gained about 2 centimeters, that's less than an inch. It's not dramatic, but it is measurable. The catch: you need extreme commitment, hours of use every day, and results are modest at best. Possible side effects include bruising, numbness, and of course, frustration if progress doesn't come. Vacuum devices, on the other hand, are great for erections, but they do not increase length. And injections? Different substances have been tried, but the risks are huge: scarring, deformity, even complications appearing decades later. I cannot recommend penile injections for enlargement under any circumstances. Now, for some men, especially those who have tried lifestyle changes, medications, or even hormone therapy without success, surgery becomes the final option on the table. There are two main categories here. One, vascular surgery. This is aimed at improving blood flow to the penis. Sometimes blocked arteries or leaking veins prevent proper erections, and surgery can help restore circulation. However, it's important to know that these procedures are not very common and are usually reserved for younger men with specific injuries or conditions. Number two, penile implants. These are medical devices surgically placed inside the penis to allow a man to control when and how long he has an erection. There are inflatable implants, which can be pumped when needed, and malleable rods, which keep the penis firm. The satisfaction rate for penile implants is actually very high, but like any surgery, it comes with risks such as infection or mechanical failure. Surgery is never the first step. It's usually the very last resort after all other treatments have failed. So let's bring everything together. Erectile dysfunction is not just about sex, it's about health, confidence, and quality of life. The journey to overcoming it is different for every man. For some, it's as simple as eating better, exercising, and managing stress. For others, it might involve medication, counseling, or advanced medical options. And yes, for a few, surgery becomes the solution. But here's the most important thing I want you to take away today. ED is not the end of your manhood. It's a signal that your body, your mind, or your relationship may need some extra care. If you're struggling, don't suffer in silence. Talk to a qualified urologist. With the right help, most men can find a solution that works. Thank you for watching. I'm Dr. Sarah, reminding you that real strength is not in ignoring the problem, but in taking steps to solve it. Stay healthy, stay confident, and I'll see you in the next video.